Thank you so much, Grace. Your talk was rad. You know what else is rad? If you take a banana and put your pinky at the tip, it always breaks into 3 parts. So, a couple things about bananas. Our next speaker, hopefully he too is rad, is Dr. Gus Vickery. North Carolina's own. He's a certified family physician. He founded Authentic Health in 2005. He specializes in personalized consultations for total body and mind optimization. He's an expert in peptides, targeted supplementation, and hormonal optimization. His book, Authentic Health, is a roadmap back to health. Welcome, Dr. Gus Vickery.
Let's explore a mystery together. The mystery is, what's happened to the health of human beings during our time? Why are so many suffering with chronic diseases, including our children? How many of you here have at least one chronic medical condition that's impacting your quality of life? If you do not, you're one of the fortunate ones. Current health statistics tell us that 3 out of 4 people in our country have at least one chronic medical condition, and most have more. Is this normal? Is this just what we should expect? Is the human species innately frail and destined for disease? Is it normal that humans would need the medical management of multiple chronic diseases throughout their lifetime, including as children? These were the questions I started asking several years into my journey as a medical doctor. I expected to treat sick people in my clinic. That's why I became a doctor. Sewing up lacerations, draining abscesses, treating severe infections, and other acute problems. What I hadn't expected was to spend most of my time immersed in a quagmire of chronic disease and chronic misery that we seem to have very few answers for. I started a family medicine clinic in Asheville, North Carolina over 20 years ago. I started it when I was just 1 year out of my training. I don't know what I was thinking. My wife and I had 3 babies in 2 years, and I was back and forth to the hospital, emergency department, and my clinic at all hours of the day and night while trying to run a business. And I had to wonder, how did I end up with all this responsibility? Be careful what you ask for. After a number of years and thousands of patients with lots of problems, I found myself becoming exhausted and depleted. And I had to wonder, why are we so sick? Why am I? It seemed like such a large and complex problem. And despite our best efforts, it kept getting worse. My patients kept getting sicker, and I did not feel great either. So, as I began to think about, from my study of human design, I knew that humans were meant to be robust, resilient, disease-resistant, and relatively long-living beings. Think about the potential of our minds and our bodies. What human beings have accomplished is truly astounding. Think about our hunter-gatherer ancestors. They had to accomplish remarkable feats with their minds and bodies, with much less resources than we have available today. And they were successful. We know that because here we are. No, we're not meant for chronic disease. Our bodies orient to health, not to sickness. As I began to deepen my study of the health of my patients, I came up with a simple formula to guide me. 1, make sure the body has all of the good information it needs to function well. 2, minimize the amount of bad information that gets into the body that can lead to dysfunction, breakdown, and disease. And 3, try to make the good information as comprehensive as possible so we can express the full range of our potential. So I got to work trying to figure out, what is the good information missing from my patients' bodies that's missing from my body? What's the bad information that's getting in? And through more comprehensive testing and evaluation, I began to see a pattern emerging. Let me introduce you to Sarah. Sarah's an 18-year-old at her first year of university. Her family had been patients of mine for years. Sarah's generally been very healthy. She did have occasional migraines, some gut issues, and some mild acne, but otherwise healthy. 6 months into her university, first year at university, her parents contact me and they're concerned. Sarah's exhausted. She's having a hard time waking up in the morning and she seems depressed. She also is edgy, nervous. She was just seen at the local medical clinic to be evaluated for attention deficit disorder because she's losing her focus. In addition, her migraines have become more severe, her gut issues are occurring daily, and her acne has become a consistent problem. Sarah isn't doing well, and her parents are wondering, what's happened? Is this just the adaptation to the college environment? They asked would I do some investigation. So I ran some tests on Sarah, including a comprehensive micronutrient panel, intracellular and extracellular. And what did we learn? Sarah had multiple essential nutrient deficiencies and insufficiencies. A deficiency is where you don't have enough of a nutrient to maintain function. It'll eventually lead to disease if it's not corrected. An insufficiency is where you have enough to stay alive, but you can't perform at a high level. She had deficiencies and insufficiencies in essential amino acids, essential fatty acids, phospholipids, multiple B vitamins, and multiple critical minerals. So what did we learn? Sarah's body is missing a lot of the good information that it needs to be able to be healthy and perform well for her. Now, is this just Sarah's problem? The answer is no. If you do a review of micronutrient deficiencies in our country, you'll learn that it's a significant problem, and it is globally as well. In our own clinic, where I've had the opportunity to survey the nutritional status of thousands of patients, what we've observed is that at least 90% at baseline will have one measurable nutrient deficiency, and most have both. So this is a population level problem. Now let me take you over to Africa. Throughout my medical school and residency, I had the opportunity to go on some medical mission trips. I spent several weeks in Venezuela, also a month in a Honduran hospital. Those experiences deeply enriched my perspective on life and health. I had thought they would just be a part of my professional routine, but running my own practice was prohibitive. So I was delighted when 18 years later I had the opportunity to go spend some time in Uganda. We were visiting orphanages and schools set up by a remarkable man named Bishop Naboth. I knew that one of the compelling health challenges for Ugandans was malnourishment. So I was curious to look more deeply into this problem. While there, I was able to tour the kitchens and the stock rooms. And yes, they need more food. It's a real problem. But I realized that if we doubled the food in that stock room, based on what was available, it's still not going to provide the essential nutrients that those children need to express their full health. And it dawned on me, here in the United States where I treat my patients, not everywhere. There are places where people don't have enough food, and that's a problem. But in general, we're overfed and undernourished. In Uganda, they have places where they have enough food, but most Ugandans are underfed and undernourished. The common variable, undernourished, not having sufficient nutrients. In either context, plenty of food or not enough food, it leads to poor health outcomes. So if these essential nutrients are part of the good information that our bodies need to be healthy, where do we get them from? Well, our primary source is food. What is food supposed to be for our body? Well, it's a lot of things, but I'm going to focus on two. Food is a source of energy, and we do need energy to run our machine. That energy comes from carbohydrates, fats, and proteins. Essentially, they're a source of hydrocarbons that we combust with oxygen to make energy. But arguably the more important thing are the essential macro and micronutrients that actually make up the structure and function of the machine itself. This includes essential amino acids, essential fatty acids like omega-3s, and the vitamins and minerals. They catalyze the trillions upon trillions of biochemical processes occurring in your body every second. They're called essential for a couple of reasons. One, we cannot manufacture them ourselves. We have to put them into our body. And two, they're essential for the structure and function of our body. They're essential for our health. Our bodies have a reserve energy system. We can actually go down the road a bit with less energy input. But when we get depleted in essential nutrients, we begin to break down. So, if food is the source of this good information, For those of us who have plenty of food, why is this happening? Well, as this study points out, there has been a significant decline in the nutrient density of the foods we have. Simply put, modern foods have less nutrients than we used to get. In addition, our food preferences, often shaped through manipulative practices of the food industry, cause us to favor foods that have a lot of energy, but not a lot of nutrients. In addition, modern agricultural methods and food processing introduce many chemicals into our food supply. A lot of those chemicals are actually toxins that are damaging to our body, and especially our guts. And if our gut ecosystem isn't healthy, then that's going to affect nutrient availability. But even worse, those toxins are a form of bad information, that if it keeps getting into our body, it's going to actually create problems. So, our source for this good information, our food, now lacks that information and is actually putting the bad information into our body. Now, nutrient deficiency and insufficiency doesn't just contribute to disease. It also limits our potentials. If you have a medical problem, or if you're tired and you just don't feel good, you have brain fog, well, you need your body to heal. Now, I do want to be clear. I am not saying that nutrient deficiency is the sole influencer of our chronic disease epidemic. There are a lot of variables, and all of them must be addressed. But if you want your body to restore normal function and heal, then it must have essential nutrients in order to do so. But if you're healthy, if you don't have any medical problems, but you have high expectations of what you'd like to accomplish with your mind and your body during your time on Earth, well, your potentials will be directly related to the availability of these nutrients. If you don't optimize nutrient availability, you won't know what your potential really was. So, we've discussed that this is a population level problem. Our bodies need this good information. This good information is essential for our health and our performance. How are we going to solve this challenge? Well, there are a number of things we can do. First, we can just care more about the food we eat. We can become mindful that the food we eat needs to provide these essential nutrients. Now, you can choose any diet you prefer, and you can eat the foods you prefer. You just can't do that and neglect your body's need for essential nutrients. Your diet needs to account for that. In addition, we can minimize our exposure to the foods that contain a lot of toxins. So we stop putting the bad information into our body. This is essentially a form of poison, and we can't keep poisoning ourselves and thinking that we're going to be healthy. In addition, we can support the organic and regenerative farmers and other food producers who are bringing truly nourishing foods to our marketplace. Also, we need to advocate for better food policies so that the food that is brought into our communities is nourishing and supporting our health rather than eroding our health. Now, the other thing we can do is just supplement essential nutrients. And that's what we do for our patients in our clinic. I would prefer for this problem to be solved with food. I'd like it if we restored food to what it was meant to be for our body. However, that's not our reality right now. And I don't know how soon it will become our reality. So I don't want my patients or my family to actually have the health issues associated with nutrient deficiency. So back to Sarah. What did we do for her? Well, we did exactly what I just said. We started her on a comprehensive essential macro and micronutrient supplement protocol. This is not just taking a vitamin. And what happened? And within a month, her parents contact me and they tell me Sarah's feeling much better. Her energy is returning, she's not depressed, her anxiety is reduced, she's sleeping better, and she can focus. She doesn't have attention deficit disorder. Also, her migraines are reducing, her gut issues are resolving, and her skin is clearing up. Sarah's elated. She feels so much better. And all we did is just put this good information back into her body. What about Uganda? So this is the question that came to me while I was there. What if every one of the children in those orphanages could have access to the same type of supplement protocol that we provided for Sarah? What if we could just put these essential macro and micronutrients into their bodies? Yes, they need more food, and there are a lot of organizations trying to figure out how to solve that problem. But while they're doing that, what if we actually just got them the essential nutrients? How much impact did that have on their health? How much does that depressurize the problem of food scarcity? From our own clinic, what we've seen is that it improves our patients' health, it reduces disease, and it actually reduces the amount of food they need to eat to stay healthy. We cannot ignore this problem. It's real, it's now, it's affecting our health, it's affecting our children's health. If we don't do something about it, then our future generations are going to lose potential and experience sickness. I'm going to leave you with a final thought. I've given you a lot of ideas to think about, and so I'm going to give you a statement. This is a quote that was attributed to Hippocrates. However, nobody knows if Hippocrates actually said this or not. It's, let food be thy medicine, and medicine be thy food. But if Hippocrates said this, the food he was talking about is not the food we have available today. So I'm going to modify the quote. Let food that is full of the essential nutrients that your body needs to be healthy and thrive be thy medicine. And let thy medicine be food such as that. Now, what if this quote became the reality for every Sarah and everyone like her all around the globe? How much impact could that have on human health? How much could that advance human potential? I would really like to find out. Thank you.